going to take ACTEA RACEMOSA. Another name is Simasifuga. It is woman remedy, all rheumatic conditions and hysterical conditions. Patient is sensitive to cold air, cold damp weather, and rheumatism is aroused in cold weather and cold damp weather. And this rheumatism is not only affect muscles and joints of the body, but all the nerves are also affected. And voluntary system doesn't obey the will. Stiffness will be there, or there is a trembling, twitching, shaking, all kind of hysterical symptoms are there. And these patients are very sensitive to cold, like Dalkamara, but headache or the head symptoms are ameliorated in cold air, cold weather. Headache relieved by cold. It affects the glands and the large organs like liver and uterus. With the pains, there is soreness of the muscles, bruised, sore feeling all over the body. And patient is very sad. There is terrible sadness in the patient. Sits alone, sits in sadness for hours together. There is terrible mental state in ACTEA patients. Mental symptoms alternate with physical symptoms. Woman very gloomy, very sad, sits in a corner of the room like Sorinum and Pulstilla. And if you will go and touch her, ask her question, she will break into tears and express her gloominess in various different ways. With overwhelming sadness, there is changeability of symptoms, mental symptoms and physical symptoms keep on changing, alternating with each other, and with this mental state there is jerking which seems like chorea. Rheumatism will change in a day into chorea, and these choreic movements or the jerkings will remain throughout the day with soreness of the body. Pressing the part aggravates jerking. Jerking, numbness and soreness may go together. Jerking of the muscles resembles like chorea, that the Kent has given the name hysterio-rheumatic constitution. The aggravating conditions of these movements are after emotions, after being chilled, and if the part is pressed. One of these nervous, hysterical and rheumatic subjects may not experience chorea throughout the day, but after she retires at night, the parts lain on will commence to jerk and she is not able to sleep. And if she turns the side, the muscles of that side will commence to jerk. And if she lies on back, the muscles of shoulder and back commence to jerk. The parts lain on will start jerking. So these subjects become so nervous, anxious and apprehensive, and fear of death is there, and because she finds no relief in any position, and there is jerking, numbness, soreness, she is restless, anguish, full of fears, and will not take any medicine. It has mania in hysterical nervous woman. It has cured purpureal mania after being chilled and soon after confinement. Mental state following the disappearance of rheumatism is main feature. If rheumatism is better and mind is not disturbed, then there is diarrhea that has set with soreness of abdomen and bowel. Some flow must be established, either diarrhea or some discharge from the uterus that will relieve the patient. Otherwise, mind will be disturbed, like abrotinum. She will become sad, overwhelming sadness will be there, sensation as if a black cloud around the head, or along with this there is a weight upon the head as if lead. Headaches are rheumatic, sore, bruised all over the head, headache brought on by catching cold. But these headaches are ameliorated in cold applications and cold air. All kinds of headache, soreness, neck pain, stiffness, ameliorated in cold air, cold applications. With headaches there is soreness in eyeballs and she is unable to turn the eyes in any direction. When ACTEA racemosa is given to a pregnant woman in accordance with symptoms, then it makes the confinement very easy. But keep in mind accordance with the symptoms. Pain in uterine region, darting from side to side, and there is pressing pain, pressing outward, and this shows that this is a good remedy for prolapse of uterus. All kinds of menstrual disorders are there: scanty menses, profuse, irregular or suppressed menses. More the flow, more the suffering. This is very peculiar symptom for ACTEA racemosa. Normally, flow relieves the suffering. It is either in the beginning of the flow or after the flow has ceased. Most severe mental symptoms, most severe rheumatic complaints, jerking, twitching, cramping and epileptic attacks, sleeplessness are all during the menstrual flow. More the flow, more the complaints. This is very peculiar. Generally, the flow ameliorate, but in ACTEA, all the complaints are during the flow. Cold and must be wrapped. Someone has named it rheumatic dysmenorrhea, not a bad name. It has all sorts of complaints in pregnancy. A hysterical patient is very difficult to cure because of changeability of symptoms. In one visit, she will tell you one set of symptoms and after a week, absolutely different set of symptoms. Shivering in the first stage of labor and hysterical manifestations run throughout the labor. There is no dilatation, no labor pains. Pains have ceased, irregular pains. Pains come on and it seems that it will finish satisfactorily, but it will go to the buttocks and end in cramp, and she will scream out of pain and has to be rubbed and turned over. This medicine will regulate the pains and it will hold on to it. ACTEA racemosa subjects are so impressionable that all kinds of emotions affect them during confinement. If an emotional story is told in the room, then her pains can be suddenly stopped. If she has passed through the labor and lochia has started up, then such emotional stories or such causes can stop up lochia, or breast milk can be suppressed from such causes or from being chilled. And ACTEA racemosa should be compared with gall of iron. which has the weakness of reproductive system, and due to the weakness she aborts in the early months of the pregnancy. During parturitions, the pains are too feeble to expel the fetus from the uterus. Uterine hemorrhages, labor-like pains, and joints are involved, small joints are involved in it, and the patient is very chilly, unlike pulsatilla. Colophilum patient wants to be covered and wants warm clothing, warm things, whereas pulsatilla wants cold things, just reverse of it. She is hysterical like Ignatia and rheumatic like ACTEA racemosa. Back of the head and neck is sore, and she has contractions at the back muscles, and so the head is drawn backward because of the contractions of the neck muscles, and she cannot lie on the back because of the contractions. It is similar to Colophilum, and compare it with Pulsatilla, Scipia, Natramur, Ignatia and Colophilum.